How will the future of work shape research issues, methods, and applications? My name is Ute Bultmann, and I'm a professor of work and health at the University of Groningen, University Medical Center in Groningen in the Netherlands. And what I would like to share with you today are my thoughts on young adults' mental health and work, and that we might integrate a life course perspective to get a better grip on the prominent questions regarding young adults' mental health and work. I live here in Groningen, the Netherlands, and I thought I would like to share this picture with you. And I will also show you a picture of my workplace. This is the University Medical Center, in which I work at the Department of Health Sciences and the section of Community and Occupational Medicine. The next slide here, you see the expected life course. It's a complex slide, and I think we should not shy away from this complex slide, which shows our complex life, because it's important actually to address the issues which are related to mental health and also work. I like the picture because it shows very nicely our life course, from early childhood to older people. It shows the stations or the transitions from school to work to retirement. It shows the different kinds of environments, like the home and family environment, where we all start, the school environment, work, and later on again, the community and home environment. It also shows nicely the socioeconomic gradient, which is present in these relationships as well. Work, health, and society, that it is what I would like to address. And Dame Carol Black said once, being sufficiently healthy is a condition for work, and maximizing healthy life as a proportion of total life is therefore a desirable goal for individuals and society. I agree with her on that, and I think the challenges to build decent work and reality also of good health is to minimize ill health and its effect on work functioning, to ensure good physical and psychosocial work environments, and to do that and to develop all the solutions for workers and families at the top and the bottom of society and throughout the life course. So we have to help workers actually to participate in work and to enable healthy working lives, because we face also other challenges. We see more and more workers with health problems at the work floor, and that can be chronic conditions, but also mental health conditions. We see that work is changing and also labor markets are changing, and we have take that into account, as we also have to look at the socioeconomic gradient again. So the challenge actually is that we have to think differently when we also do our research, because the current work and health research is actually quite fragmented. It focuses on specific parts, on jobs or exposures. And we believe actually that traditional occupational and psychosocial EPI methods and research are no longer sufficient to address all these complex issues. So why a life course lens when looking at work and health? Well, a person's health does not start when work begins. And where a person works depends on where the person grew up, who the person grew up with, and also education. And that is why we think that a more integrated approach is needed that considers the working life course. Because our working life is preceded by childhood with training and school, and is of course at the very end we have the retirement transition and our older age life. So it is important to look not only at our working life, but also the time before and the time afterwards, also when we look into the new world of work. And when we look into key life course principles, I would like to focus us on the transitions. There are more of them, but the transitions are important. And the nature and the timing of these work-life transitions are constructed by the social context, as we know. For example, the school-to-work transition, changing careers, and getting unemployed. A sequence of these transitions actually builds a working life trajectory. And we have to take into account that political changes, but also the global economy change and shape the social context, and that, of course, also affects the labor markets. We are very happy here in the Netherlands, in Groningen, to address all these issues in a study which we called Working on It, because we are working on it. And I would like to share a very few slides with you briefly, like what we are doing. We call the project Today's Youth is Tomorrow's Workforce, because we see that more than 50% of all work disability claims in the Netherlands are among young workers with mental health problems. And as I said, we know that young workers actually work and live in the new world of work. And to build the working life trajectories of these young workers, we have to use this life course perspective. And that's why we are very much interested to focus us at the status at the labor market, and to explore and elaborate on their values of work and also on their work experiences and their perceptions of the work environment. We will be able to do that in a unique sampling frame, which is called Tracking Adolescents Individual Life Survey. It's a longitudinal cohort study starting of the age of 10, 11. Now the young people are 28 to 30 years old, and it's very exciting because we just completed the last measurement wave in which we really focus on the new work environment and the work environment of these young people. So what we have done very recently is we have published a research agenda in the Journal of Epi and Community Health, and I would like to invite you all to read the article and look into what our thoughts are and our research agenda and research questions regarding the role of transitions when we look into the working life courses of these young adults with mental health. Thank you very much for your attention, and I would like to finish with a slide. I think that the overall aim is really to enable healthy working lives, and I also believe that if we succeed in adopting a life course perspective and translating our findings into relevant policy and practice measures, we together, researchers, healthcare professionals, and employers and policymakers, we can make a difference. Thank you very much for your attention.